listening to Living with ADHD and CPTSD, available on Apple and wherever you get your podcasts. Hello everybody and welcome to another episode of Living with ADHD and CPTSD. Today we have an ADHD episode and I am going to talk about the stigma and misinformation around ADHD and stimulant medications. So this is something that a lot of people who have ADHD in the past and present deal with a lot, and they may not necessarily deal with it directly. A lot of it is indirect dealing because of the fact that there is a stigma about ADHD in the world, and a lot of it is harmful and not appropriate and gives people a predetermined aspect or feelings and thoughts about a person who has ADHD and what they're like. So this is what we're going to talk about tonight, okay? All right, so ADHD, these are some of the things that are said by companies, people, whatever, that are misinformation and stigmas, okay? ADHD is a made-up disorder. Only lazy parents would drug their child into submission. Stimulant medication turns kids into zombies. You give your child speed? You're just creating a future drug addict. Pharmaceutical companies and psychiatrists are just colluding for financial gain. Sadly, there's an enormous amount of unfounded judgment, criticism, and misinformation in the community around ADHD and stimulant medication, which adds to the stigma kids with ADHD and their parents experience. Unfortunately, this stigma, or mark of disgrace, can have severe, if not dire, consequences on the outcomes of kids with ADHD. For example, fear-mongering, as well as the judgment and unsolicited advice parents can find themselves subjected to, can influence whether a parent decides to have their child assessed for ADHD or not, leads to parents in underestimating the risks involved with having poorly treated ADHD, muddy the truth around best practice evidence-based ADHD treatment options, interfere with parents being able to make informed and educated decisions around how to best support their child with ADHD, affect treatment adherence and treatment efficiency. I find this extremely concerning because unfortunately I know firsthand the impact living with undiagnosed and untreated ADHD can have on your self-esteem, and self-worth, as well as your quality of life. And I would not wish the pain and suffering it caused me on anyone. The problem is, how do we stop it? I wish there was an easy answer, for despite the dedicated efforts of some truly amazing individuals, the stigma just won't go away. So in the hope of contributing to the conversation, I made the decision to join in the conversation by sharing my story of growing up with undiagnosed and untreated ADHD, along with what the current research trends say in regard to the risks associated with poorly treated ADHD and stimulant medication, even if it leads to only one person stopping and reconsidering their opinion or being more mindful of the influence their words may have. My effort will have been worth it. So let's start with my own personal experience. This video of a presentation I gave at the WA Mental Health Association Recovery Stories Showcase in May 2018, which I will put on the podcast so you can watch it. After watching it, I am sure you will understand why I was diagnosed with ADHD as a child and given the opportunity to take stimulant medication in conjunction with receiving other evidence-based treatment options. So the video is called Look Before You Leap, Thriving with ADHD. It is something that I will put on. It is from YouTube, so you can go and watch it there. As for the risks associated with poor treatment outcomes, the research clearly shows that whilst children with mild ADHD symptoms may respond well to behavior interventions, such as parenting from an ADHD perspective and classroom strategies alone, children with moderate to severe ADHD symptoms tend to experience little improvement when these interventions are implemented in isolation. Sadly, the effective treatment of a child's ADHD symptoms can negatively influence their ability to meet expectations, achieve their goals, maintain relationships, and negotiate life. For example, poorly managed ADHD symptoms can negatively affect a child's academic achievement as they impact directly on a child's ability to sustain focus and concentration, especially if a task is boring or tedious, absorb, process, and recall info, prioritize, plan, and problem solve, work out what piece of information they should pay attention to as they struggle to filter the information they receive from their internal world and from the world around them for relevance. Stay on track and complete tasks to fruition, as well as transition away or disengage from tasks they are absorbed in. Pause and inhibit their words and actions, which can contribute to impulsive decision-making, careless errors, accidents, and injuries, and social violations such as interrupting others or blurting out answers in class. Inhibit and modulate their emotions. Deal with delay aversion due to their inability to cope with discomfort, which may contribute to them acting impulsively in order to terminate the delay. For example, pushing in, interrupting, or badgering others, opting for immediate, smaller rewards rather than delaying gratification in order to achieve long-term goals. Perceive time and regulate their attention, behavior, and motivation relative to time. Interact effectively with their peers. In addition to this, poorly managed ADHD symptoms also greatly affect a child with ADHD's ability to self-reflect, as well as develop self-awareness and accurate self-perception, communicate effectively, think socially, interact with others, be accepted by others, and form bonded relationships, participate fully in extracurricular activities, and develop independence. Their symptoms can also negatively impact upon parent-child and child-sibling relationships and family function. As a consequence, a child with ADHD's self-esteem and quality of life can suffer for when children with ADHD are unable to meet the expectations placed upon them and therefore experience failure over and over again, even when they are trying their hardest, constantly on the receiving end of correction, redirection, criticism, and possibly social rejection and isolation. They are more likely to feel frustrated, embarrassed, humiliated, demoralized, and discouraged, as well as ashamed, inadequate, unworthy, and regretful. This may also come to believe over time that they are fundamentally different, flawed, or broken, and begin to anticipate or predict future failure. Poorly treated ADHD in childhood no doubt contributes to the reasons why adults with ADHD are at high risk of developing anxiety and depression, alcohol and substance abuse issues, and eating disorders. They are also at higher risk for criminality, self-harm, and suicide, with the suicide risk of individuals with ADHD being approximately 1.8 times higher than the general population. These mental health risks are frightening and, as you would imagine, not much fun to live with, and they are not something I want for my son or any other child with ADHD to experience. Which makes me question, why haven't I come across a commercial media article or documentary that has discussed any of the potential mental health risks associated with not effectively treating kids with ADHD? Or has that made mention of the other risks associated with poorly treated ADHD, such as future financial difficulties, car accidents and injuries, relationship challenges and marriage breakdowns, and shorter life expectancy? Also, why does the media seem so hell-bent on focusing on the potential side effects of taking stimulant medication? All medication potentially can cause side effects, and the substantiated risks which feed stigma and increases the chance of kids with ADHD having poor outcomes. Goodness knows. So, yeah, it's one of those, I guess you could say, things that, because, well, think of the famous saying, what you don't know can scare you. So, a lot of people out there don't know much about certain things, especially like ADHD. And so they kind of gather false or incorrect opinions about something like ADHD, and they make up their own things, or they hear something from somebody out there who believes that ADHD isn't as serious as they think it, as people think it is, that it's not real, or that it's not, it's something developed artificially or whatever, right? Or it's the result of the parent doing something before the child was born. These kind of things are harmful for people with ADHD because it can influence not only the parents of a child with ADHD, but also adults who are trying to get diagnosed with ADHD and end up telling people who they know and are trying to get support and encouragement and someone to listen to. And unfortunately, the person that they're talking to has an incorrect or ignorant assumption based on ADHD and can discourage their friend to getting a diagnosis, which is really stupid and unfortunate. And it does happen a lot because a lot of people are not very educated when it comes to ADHD, and so they make false assumptions and believe something that is improper or incorrect that is said by someone who is in high regards out in the world, who a lot of people think is very knowledgeable when it comes to things like diagnosing disabilities. So that's not safe and it's not smart for someone. So people in the world, and especially in ADHD societies and organizations around the world, need to get the word out and teach people more about what ADHD is and exactly the truth about it, instead of allowing these false myths and assumptions and ignorant facts overtake, the perception that is created. So if you ever see a video or you hear an article, like I hear a radio program or read an article that is showing incorrect or misinformation or false ideas about ADHD, you need to bring it up with either the person who wrote it or the magazine or the radio company or whoever happens to be involved in it, so that maybe they will hopefully correct themselves and let the public know that they were incorrect in their assumptions or what they were saying in regards to ADHD. All right, everybody, I'm going to take a break. And when we get back, we will talk more about stigma and misinformation with ADHD. All right, talk to you soon. Welcome back to Living with ADHD and CPTSD. Again, talking about stigma and misinformation in regards to ADHD. So before I continue, I'd like to just read a basic quote. According to Russell Barkley in 2015, he states that stimulant medication produces few mild negative side effects. However, if a child does experience negative side effects, they either develop tolerance for these symptoms or their symptoms can be reduced to a tolerable level by lowering their medication dose. Occasionally, changing to another stimulant medication or non-stimulant medication may be required. So, excuse me. Let's rectify some of these things by examining what the current research says in regards to 3 risks often highlighted by the media. First one, your child won't grow if you give them stimulant medication. There is some concern that long-term stimulant medication use may affect the growth trajectories of children with ADHD, resulting in mild growth suppression. For example, a meta-analysis of 22 studies found that stimulant medication had a statistically significant effect on child's height and weight. However, some studies suggest that children with ADHD may display different growth trajectories to neurotypical children, and that it is the disorder itself, not stimulant treatment, that is responsible for these differences, according to Russell Barkley. Parents, therefore, should be encouraged to weigh up the potential risk that their child may not grow as tall as their peers against the potential risk of their child developing mental health issues when making treatment decisions. Childhood use of stimulant meds lead to future drug addiction. Concerns that stimulant medication may increase the risk of later substance abuse appear unfounded, as these claims have been refuted by more than 14 studies. Instead, the data suggests stimulant medication may significantly reduce substance abuse risk in individuals with ADHD. For example, in their 2016 study, McCabe concluded when stimulant medication treatment is started early, before age 9, and continued for more than 6 years, it may cut the rate of substance abuse in half. In fact, they found stimulant medication reduced the risk of substance abuse in youth with ADHD back to the same level of risk-associated youth without ADHD. Please note, when taken at therapeutic doses, stimulant medication does not produce the euphoric effects associated with drug abuse in individuals with ADHD. Stimulant medication will harm your child's brain. The prefrontal cortex, which is the part of the cerebral cortex, is the part of the brain responsible for one's executive functions. Studies currently show that taking stimulant medications to treat ADHD does not adversely affect the development of the brain's cerebral cortex. Barkley, 2015, stated that. In 2015, excuse me. Instead, there is exciting evidence emerging that indicates stimulant medication may have a protective effect on a child's brain, as there are over 32 studies that show the brains of kids with ADHD who continuously take stimulant medications in the long term develop in a manner that is more in line with their neurotypical peers. In other words, stimulant medication appears to promote brain development. I hope that from reading this, it is very clear why the stigma and misinformation around ADHD and stimulant medications needs to stop, and why the ADHD community would be so very grateful if everyone would stop and think before they voice their opinion on the topic, for they really do not know how much harm they may be doing. For all kids deserve to develop into well-adjusted, happy individuals who contribute positively to the world and thrive, whatever it takes. Alright, so here we go. That's the article, and I will post the video like I said. It is very interesting read, and the video, which I haven't seen yet, I believe is also very good. To read one more article. It is called A Pharmacist's Personal Experience Breaking Down Stigma to Improve Outcomes in ADHD. Misconceptions about the diagnosis of attention deficit hyperactivity disorder reduce the credibility of healthcare providers and delay or prevent treatment for patients suffering from this condition. Alright. Mom is having ADHD, something I should be sad or worry about, my 9-year-old son asked one day when I picked him up after school. In that moment, my mind raced to hundreds of possible situations that could have prompted this question. My husband and I have always been open and honest with him about his diagnosis and included him in discussions about his treatment, including his feelings on efficacy and adverse effects. We have done our best to avoid and address those social stigmas associated with attention deficit hyperactivity disorder, ADHD, and provide him with meaningful responses to address situations. No, having ADHD is not something you should be sad or worried about. What made you ask this question? Did something happen that I should know about? I urgently replied, with just a tinge of angst in my voice. My friend was on the playground crying today. When I asked her why she was crying, she told me that it was because her brother was diagnosed with ADHD. I told her that everything would be okay. I also have ADHD and I'm doing just fine. He may have to take medication. He may have to go to special classes, but not to worry because everything would be just fine, my son responded. Mom, do you think I said the right thing? Is there something else I should have said? Why would her brother having ADHD made her sad enough to cry? What powerful questions coming from such a young boy. I understood in that moment the significant amount of social stigma I would have to unpack with my son. Misconceptions about the diagnosis reduce the credibility of healthcare providers and delay or prevent treatment for patients suffering from this disorder. This situation brings added focus to the 2021 theme for ADHD Awareness Month, Reframing ADHD, Discovering New Perspectives. It reminded me as a pharmacist mom of my role in educating my community, in addition to my family, as well as the importance of advocacy. Like other psychiatric disorders, the diagnosis for ADHD has been developed and refined significantly over time from its first mention in the DSM-2 to the current iteration in the DSM-5. Delving back even further, ADHD has characteristics of the disorder first mentioned in text by a German physician in 1775. This diagnostic evolution has been criticized for its subjectiveness and reports of increased prevalence. The criticism over diagnostic subjectiveness can be countered by the following points. First, diverse trained professionals agree regarding the presence of absence of well-defined criteria. And second, diagnosis is a useful predictor for defining future comorbidities. Improving future outcomes, understanding patient-specific response to treatment, and defining features indicating a consistent set of causes for the disorder. The perception of increased prevalence has been attributed to advances in both administrative and clinical practice changes leading to increased diagnosis. Furthermore, meta-analysis of 135 students, including roughly 250,000 children and adolescents spanning 3 decades, shows that prevalence rates remain stable between 5.9 to 7.1%. Prevalence notably decreases as patients mature into adulthood, with reported adult prevalence rate ranging between 2.5 and 2.8%. This trend is further highlighted by decreased prevalence in persons 50 years of age and older, with reported prevalence ranging from 1.5 to 0.02%. There are also specific gender and racial differences among groups. Black youths, those 18 years of age and under, have a reported prevalence of 14%, and boys have a higher prevalence than girls at a rate of 2 to 1. As pharmacists, we play a key educational role in helping patients and parents understand that ADHD causation is, for most individuals, an accumulation of genetic and environmental risk factors. This information goes a long way in heightening understanding that factors outside direct patient control and not individual shortcoming are likely causative. Pharmacists are easily accessible community resources who can assist in the breakdown of traditional stigmas associated with being different. We can help patients recognize treatment in the context of chronic condition management. We can assist children and parents in gaining an understanding of treatment options that have shown benefit versus those that have not. We can aid our communities by providing a clear message stating that ADHD is not intrinsically negative. We can change the stigma around ADHD by reframing the diagnosis into a solution-based mindset that allows for treatment planning, risk mitigation, and evolving treatments. We can encourage patients to seek multimodal treatment pathways, including behavioral therapy in combination with medication, which is currently established gold standard of care. We can inform patients of risks associated with diagnosis, specifically the increased risk of comorbidities such as substance abuse. We can explain the importance of continuous clinical follow-up throughout the course of the disorder because treatment should be adapted over time. Okay, so there we go. That's that article. This was written by pharmacists, just in case you're wondering. All right. So, fortunately for myself, not a ton of people know about the fact that I have ADHD. True, I am getting an assessment done in April, and hopefully the diagnosis will be official then. The fear in telling people is the fact of the stigmas and the misinformation and misconceptions about ADHD that people who don't have it and don't know much about it start to think and believe before they truly know anything, before they know what to say and think and feel about someone who has it. So I haven't told anybody in my family, and I haven't told, obviously, my employers. I'm waiting for an official diagnosis so that I can say, here, this is an official diagnosis of me having ADHD, blah, blah, blah. And then I can actually go to my family and say, so I've been doing some research and some work and such for over a while now, and I was officially diagnosed. And I'd like to discuss it and talk about some reasons as to why I was this way, why I was that way when I was a kid, and certain explanations of behaviors as an adult. It is hard to think about it when wanting to bring it up with my parents, especially. I was not too long ago with my parents and my brother, and we were having a lunch. And I remember while I was driving to the restaurant that I was potentially considering telling them. And I got close, but I never did say it because I didn't know if I would be able to handle the possibility of a negative or, incorrect thought or judgment about ADHD. And I didn't want them at the time to think differently of me and how I behave and the explanation. I know that there is a good possibility that they're going to think highly of the diagnosis and that they're going to be happy and that it will bring up the good old, oh, so that explains this, or that's why you were like this when you were a kid. And it would be great, it'd be nice to have that kind of a response. It's just knowing the history of my parents, especially my father, I just have this gut feeling, an intuition that if I did say it before having any kind of diagnosis and having enough information to really show them exactly what's going on, that he might not take it seriously, and that would be pretty devastating. I'm hopeful, but I just don't for 100% think that it's absolutely going to happen, which is too bad, but that's just, some people have to deal with that, and that's just the whole stigma. Plus, I guess you gotta realize his generation, which was born early 40s into the 50s, are very different than my kind of generation, or even the generation that's sooner than I am, or more recent. Their thoughts on health and mental health is a lot more rigid and less forgiving and open-minded than someone who's my age or 20. for example. So you got to keep that in mind too when it comes to discussing it with my parents. So stigma, yeah, it's not something that anybody who's trying to get diagnosed or who has been diagnosed with ADHD, or parents whose child is getting diagnosed, especially if they happen to have a doctor or a psychiatrist whose ideals and beliefs are outdated, that doesn't help. But the truth is that medication and other forms of help, like proper diet and exercise and keeping the mind busy, is very helpful for a child to have a better chance at living a more complete and more effective life with ADHD. It's something that I guess over time will become easier, and as the generations continue to come, that we will have more and more acceptance of ADHD and less criticism, and the stigmas will go away. And ADHD will become more accepted and more traditionally, part of society. Mental health is definitely not something today that is still widely recognized and worldly recognized. There's a lot of places who try to hide it or don't want to talk about it, It's too bad. It really sucks that that's the case in some countries. But you just have to fight on. Don't let anybody else decide for you what you want to do or what you believe. The only person that matters is yourself when it comes to these kind of decisions. So that's the key. Okay, that's today's episode. I do have a couple of announcements. One is I am setting up an interview with a lady from the UK, and we are going to discuss ADHD in women, which is something that I've been trying to do for quite some time now, and I finally found the right guest to discuss ADHD with women, and I hope that especially the women out there will tune in for this episode. It should be very educational and very interesting, and I'm really looking forward to doing it. Like I said, my diagnosis or my assessment is April 19th, so about a month and a half from now. It's going to be a lot of fun. I am quite nervous, but it's something that I've been looking forward to for a year now. It's been about a year since I first went into the process of trying to get my ADHD diagnosed and get medication. It's amazing how a year has already gone by. It's pretty outrageous. Okay, so if you want to reach me, I am on Twitter, Facebook. There's my website. My Twitter account, the handle is at ADHD and CPTSD. Please come to Twitter and talk to me. Find me. Give me a follow. Say hello. Chat. If you want to talk about ADHD, I am more than happy to, and I would love to talk for hours. My website is www.livingwithadhdandcptsd.ca. You can contact me there as well. There's a lot of references and helpful articles or information on there, and there's a bit of a get to know me on there. My Facebook page, of course, is there, so Living with ADHD and CPTSD. You can support me by donating to me. Just go to ko-fi.com, which is ko-fi.com, and you can donate either a one-time amount or you can do a monthly plan, and there's two different rates that you can do, and it's not very expensive at all. And like I said in one of the articles today, if you're really interested in doing a lot of research and finding out all that you can about ADHD, find on YouTube Russell Barkley. He's an amazing doctor who knows a lot about ADHD. If there's anybody out there that knows about it more than anybody, it's Russell Barkley. He's an amazing person. I'd love to get him on the show one day, maybe in the future. That's pretty much it. I appreciate everybody coming and listening to my episodes. I've been really doing this for about 5 months now, and it's a lot of fun. It's a lot of work because you got to come up with episodes and you got to find the information, and I got to think about my own information, my own examples and situations and experiences to bring into this discussion. And as you know, with ADHD, it can be difficult to focus, and I've been doing a hell of a job because it's really been, some days it's a lot harder to come up with ideas than others. I really want to hear from you guys. Contact me. Give me some information. Let me know if there is something that you would like me to discuss in an episode, or if you would like to be a guest on my show and I can interview you. Contact me. Go to my Twitter site. Go to my webpage. Just give me a shout. Let me know. Like I said, I am happy to talk to you. I am very open-minded and very supportive of anybody with ADHD or CPTSD or autism. I want to chat. Give me a shout. Don't be shy. I would love to talk to you. Anybody. Okay. That's it. For those who are also listening to CPTSD episodes, I will have another one tomorrow, as usual. All right, everybody. Have a great day. Talk to you later.